There's nothing worse than having your time off for the holidays marred by illness. And with cold and flu season upon us, Dr. Karim Ali from Niagara Health tells us how we can avoid getting sick this winter. Dr. Ali, are we seeing the flu taking hold right now?
So thank you for having me. And the expectation or what we predict now is that influenza will likely take over the numbers in terms of COVID around the holiday season. So we are starting to see an increased number of influenza cases. Not to say that we are not seeing COVID and RSV, they all continue, but influenza seems to be getting in now more and more.
What are the techniques? What should we be doing to make sure that we guard against contracting the flu?
So going back to the basics, right? Like every year this time around this season, going back to the basics of staying home if you're sick, making sure that we wash our hands, we do cover our mouths and nose when we cough, and these things, right, like basic things we can do. And one of the most important thing I would say we can do for ourselves is to make sure we get the updated COVID vaccines and influenza vaccines.
Is there a particularly nasty strain of the influenza virus that you're expecting this winter?
Influenza tends to be, influenza can make people much more sicker if you compare this to COVID, right? And I would say it's not that we have a particularly difficult strain. The data, in fact, from the southern hemisphere, right, like their winters are in our summers, the data from there shows that this time around the vaccine seems to be a good match. So having that influenza vaccine, taking that influenza vaccine, especially for high-risk individuals, is very, very important. So it will not prevent you from getting the flu.
Right.
It will prevent the hospitalizations, symptoms, the sickness that you really tend to see. We have already seen some young people in our ICUs. Young
with
people with the influenza, people who have had no underlying comorbidities. Not to say that we don't see it, even in regular influenza seasons, right? Like we do continue to see this, but this was a bit early that we saw.
You mentioned high risk. What defines someone who might be high risk?
So people with underlying medical illnesses, especially lung diseases and heart disease. People who are 65 and older, they tend to have the worst complications and worse sickness, whether we talk about influenza, whether we talk about RSV, or whether we talk about COVID-19. One important thing, one thing to distinguish here in children, right? Like so RSV can affect people at the extremes of ages. So very young children and elderly.
Right.
Influenza also tends to do the same thing, but influenza can also make otherwise healthy young people very sick. Influenza vaccine is available for everyone 6 months and older.
How does someone go about booking a vaccination?
So your primary healthcare provider and
pharmacies as well?
And pharmacies with the influenza and the COVID vaccines. The RSV vaccines right now are available through the public health. It's available for people who qualify for it right now.
What about the cold season, basically?
So as in like a cold season, this cough, flu, and cold season, right? Like it's expected to last until, it starts from November until the end of March or May, April. So we'll continue to see that.
What else can people do?
Staying home if you're sick to the best of your ability. I know, this is the holiday season, right? Like, so we want to be with our folks. We want to,
Does that increase the risk that we come together for these holiday events?
That risk is always going to be there, right? Like what COVID pandemic has done is made us more aware of this. So you really, the best thing you can do is sit down as a family and decide what amount of risk you're willing to take, right? It's not that you shouldn't live your life, right? Like if you're sick, then maybe, making sure until you are better, not to mingle with people, Not to say you shouldn't do what you're supposed to around the holiday season, but that's an important thing. And if you are in, sort of close gatherings and all, if you're not feeling well, and if your risk perception is such that you can consider wearing a well-fitted mask for yourself too in the indoor settings.
We have learned a lot over the last 3 years because of the pandemic, and that really has allowed us to, I guess, make some other decisions with regards to flu and cold season as well.
Yep, and I would, want to bring us back to one thing that, hospitals, right, like we take care of everybody, right, like so anybody who feels sick can come to the hospital, but this time around, right, like around this season, every year there tends to be a higher number of individuals coming in with respiratory illness. And don't forget, right, like us healthcare workers, we are also part of this community.
That's right.
And this affects us too. So combined, right, like these two things combined, where more sick people showing up and healthcare workers also being sick during this same time around, like it tends to be the not so ideal combination. So for minor illnesses, knowing your options is very, very important, right? So pharmacists can prescribe you certain medications for common ailments. That's one different thing this year, and I really want us to think about it and avail ourselves if such is the case. But if you're not improving, if you have shortness of breath, and if you're at higher risk of complications like we talked about before, obviously you're going to call 911, you're going to get to the hospital, and we'll take care of you.
Dr. Ali, thanks so much for coming in today.
Thank you for having me.